So, good morning, sir. My name is Paul Oladipo. I'm a fifth year medical student and the editor-in-chief of the KB Club. The KB Club is a social philanthropic organization established in the year 1969 by Professor Oladapo Ashiru OFR and 700 medical students. And the aim was to promote leadership, skills, academic excellence, and philanthropy amongst medical students in the College of Medicine, University of Lagos. The editorial board of the KB Club releases another magazine named Merifil, a portmanteau of medicine and philanthropy. This year's edition of Medfield is themed Kaizen, Ethos of Heroes, and we aim to celebrate individuals like yourself who exemplify continuous improvements and impactful contributions to the society. So today's interview is an opportunity to hear about your journey in public health, your leadership experiences, and the lessons that have shaped your remarkable career. So we are truly honored to have this conversation with you.
So first of all, we'd like to know about your background, um, where you are from, your educational journey, and some key moments that shaped your career.
My background and my educational journey. Okay. So my name is Akin Abayomi. I'm from Lagos Island, Ward B1, Church Street. I was born in Lagos, but my father to a Lagos Island family, and also with extension into Surulere. So I think in those days, those people that lived on the island also had farms in Surulere. It's hundreds of years ago. And so if you go to Surulere, you will see Abayomi Street, Anjorin Street, Akerele Street, Olatilewa Street, or Tilewa Street. So those are all my great-grandfather is Anjorin from Church Street and Lawanson and Idiaraba, where you have your College of Medicine is at my ancestral land. So you have to start paying rent. Okay. So I was born in Lagos, but I only spent a few years in Lagos before my father was posted. He was an agriculturist, so he was posted to Ibadan, to More Plantation, Ministry of Agric and Natural Resources. And so I spent my primary education in Ibadan at Mary Hill Convent School. Then I came back to secondary school in Lagos, King's College, and then I did medicine I went to the UK to study medicine. I studied at the University of London, and I did my first postgraduate degree in internal medicine in the UK at the Royal College of Physicians. And then I came home to do my NYSC, and then I went on to specialize in Ibadan at UCH. I did haematology, and then I went back to the UK, and then from the UK I did some work in the Middle East, in Saudi Arabia, in Zimbabwe and South Africa. While I was in South Africa, I did the College of Pathology, second postgraduate degree, so subspecializing in hematology and oncology. So I'm a physician, hematologist. I also did a fellowship in bone marrow transplant, and I did a master's in environmental ecology, and that all led to another subspecialization of biosecurity and environmental health. I think that's my journey in terms of education. What shaped my career pathway in those disciplines? Studying medicine is a basic education. After that, it's desirable that you specialize. I wasn't quite sure what discipline I wanted to specialize in, but when you do internal medicine, like you do surgery or obstetrics, there are sort of the next step, subspecialty, or the next specialty after studying medicine. So doing internal medicine gave me a broader exposure to, cardiology, respirology, endocrinology, hematology, immunology. And it was while I was doing that I realized that I had an interest in blood and the hematopoietic system and immunology. And so I sort of veered off as a hematologist. I veered off into subspecializing in hematopathology, clinical hematology, and hemato-oncology. And then I realized that, I had a passion for environmental health. And so somehow I was able to link environmental health to human health. And that sort of collided with, the advent of zoonotic events like cholera, Ebola, COVID. There are conditions that exist in nature that are able to pass on to human beings. And, the science of One Health is that understanding of how human beings are part of an ecosystem. And if you're not careful, pathogens can move very quickly from the environment to human beings. So that's how I evolved my interest into zoonotic diseases, and that seemed to collide with the seemingly increasing number of zoonotic events that we're seeing globally, as a result of human and environmental interface. So that's where I am now.
You've spoken about your expertise in healthcare and your career. So we'd like to know about your key mentors and influences that you have.
So I guess, when I was young, I was good in the sciences. And, in Nigeria, if you're good in science, they kind of usher you to study one of the medical disciplines, either medicine or dentistry or veterinary medicine or something like that. My family has a strong lineage of doctors, so it just seemed as if I would go in the same direction. So that's what happened to me. But I guess, there are always people that you see in your career that inspire you. This was across the board. In my time in the UK, I came across some very interesting and notable medical professionals. In my time in the Middle East, in my time back in Nigeria, when I spent significant amount of time in Ibadan, at the University of Ibadan, and there are lots of great leaders in the medical field, and I guess the Ibadan is a place where there's a great hunger for academic inquiry. So that sort of pushed me in the direction of academia. So my exposure in University of Ibadan, University College Hospital, kind of made me more of a inquisitive doctor. So it kind of made me question everything around me. So I didn't sort of practice medicine absent-minded. I was like always, okay, so why is that happening? And how does that lead to this? So then I discovered that really maybe I had an academic mind and I should stay more in the academia, which is what I did. So wherever I went, I remained in a university setting, or at least in a research environment. And also, I discovered that I had a skill to transfer knowledge, to teach. And so when you put the academic research interest together with the ability to transfer knowledge, you become an academic. It's a bit, once you've experienced academia, it's difficult to go and just become a practitioner, because it seems life becomes boring just seeing patients, on a day-to-day basis without people around you who are constantly asking questions and doing research and pushing the frontiers of medicine. So I think by nature, at heart, I'm an academic and a teacher.
That's a wonderful response, sir. So, sir, we discovered that you worked across 4 continents and 8 countries. What motivated you to take your expertise global, and how have your diverse experiences helped shape your role as a commissioner, sir?
So I think two things. First of all, I think I'm an adventurer, so I'd like to go and explore different geographical regions, look at the culture, look at the disease patterns there. And so I seem to just be naturally pulled to go to places that people generally would like to stay in one location and build their career. So, they say that if you move around, that you lose your academic focus, but that didn't seem to be the case with me. I moved around, but I moved around in time frames that were long enough to establish deep roots in those places. So, for example, I spent almost 14 years in England, then I spent 5 years back in Nigeria, then I went to the Caribbean. I spent another 10 or 12 years there. Then I went to Southern Africa. I spent another 12 years there. So in those periods of about 10 years, it's enough time to really embed yourself and understand the environment and become an influencer in that environment. I think the other thing that helped was the discipline that I chose, which was hematology. Oncology is a rare discipline, and so there's always a demand for that expertise anywhere in the world. So if you say you're an obstetrician, well, there are a lot of obstetricians. But if you say you're a hemato-oncologist, there are very few, So I found it easy to move around to places of my choice, because no matter where you went, if you said you are a hemato-oncologist, there's always an opportunity for you in that location. And so I think that's those two factors, my natural sense of adventure and, the scarcity of that sub-specialization made it easy for me to move around. And how did those experiences shape my current function as a commissioner? Well, it's nice to go around the world and see what everybody is doing. And then when you come home, you now can sort of look at what you've seen in different locations and see how they've solved those problems and then come up with a homegrown solution, but informed by your exposure to different parts of the world. So I didn't have to I'll just look at the problem in Lagos and say, well, how did they solve that problem in the Caribbean? How did they solve that same problem in the Middle East? How did they solve that problem in the UK? How did they solve that problem in Southern Africa? And then I put the whole collective thinking together and come up with what I think is a solution for Lagos. So it's helped me tremendously to have this sort of global perspective and overview.
Brilliant, sir. I'm very impressed with everything that is going on so far. So, sir, the next question is, what led you to transition from healthcare to public office, and how did you navigate that shift? Do you see yourself pursuing higher political positions in the future?
So the transition happened accidentally. I was busy doing my own academia. But one thing I was doing was I was always lobbying and trying to support government. So whenever the government was in a crisis, whether it was in the Caribbean or in Nigeria or West Africa, I would always reach out to policymakers and say, you're experiencing a problem here, how can I help? And then bring in an academic perspective into the situation. And so that's what I was doing, in Lagos. The Commissioner for Health before me was a colleague from King's College, and we knew each other, and he was going through some stressful experiences, and I just reached out and I said, from my own position, how can I help? And I became an advisor and a consultant to the government, helping them develop ideas and strategies. And it just came one day that there was a transition, and there was an opportunity, and I was asked if I was keen on the opportunity. Of course, I never thought about it, so it took me a long time to digest leaving my comfort zone of being an academic to one of being in policy, government, and politics. Because that's a whole totally different ballgame. But I was encouraged by a lot of people who had made that transition themselves, and they said it was not as bad as I think. So I took the bold initiative, and indeed, it's been very interesting. It's like going back to school. You have to go and learn a totally different terrain, a totally different way of talking, a totally different way of thinking, a totally different way of relating. And these are for someone my age, to start going back to the drawing board and learning how to navigate an environment that's not simple or easy has been challenging, but I think I've managed to survive. I'm still here anyway.
Yes, sir.
Yeah.
Right, so just to complete the question, are you also thinking about pursuing higher political positions in the future?
Well, I was trying to dodge that question.
It's a progress.
No, I think at this stage, if I do 2 terms as commissioner, then it's time for me to really go back and relax on my farm and start looking after grandkids.
Yes,
but you never know. I mean, if there's an opportunity where I feel that I can still stretch myself and be of service to Lagos or wherever, and I'm not too preoccupied with my other interests. If I see that the common good is overriding my own personal interest, then I will consider. Yeah.
Right, sir. Thanks so much, sir. Right, so before your appointment as Commissioner for Health, you were a professor at the Niger Institute of Medical Research and principal investigator at the National Institute of Health. How did you handle the transition, and what new challenges did this role present?
Yeah, so it's similar to the last question in terms of, it's a very different environment. But, once you get over the transition phase, you'll find that it's actually not that different, because when you talk about politics, I'm in a political environment, so-called politics, But let me tell you that from the day you are born, you start playing politics. All right. What is politics? Politics is basically competing for resources. So when you're born into a family, you're born into a family of other siblings, or other siblings arrive. If you're a twin, you start playing politics even before you're born, because you start competing with your twin. And that's what all politics is about. Politics is about competing to get the best resources for your constituency or yourself. And so we are all political. You know, when they ask you, are you a politician? The first response is no, I'm an academic or I'm a technocrat. But that's not true. You are all politicians. You're playing politics right now, you know, by virtue of forming this association to gain a higher ground for a higher purpose, you know, and that's what you do. So it took me a while to understand that politics wasn't alien to me, you know, it's just a different flavor, you know, because in academia you play politics. At home you're playing politics. In your clubs and your social environments, you're playing with your friends, you're playing politics. Amongst your siblings, there is politics. So life is all about politics, you know. So if you just feel that you've left a academic politics to work in a policy framework politics, it's just, you know, it's the same technique, you know. And so once I got over the shock that I was actually a politician from birth, you know, then it became easy for me to just accept the mantle of being a technocratic politician and just get on with navigating the course.
So thank you very much for that, sir. And I now have a very different view about politics. So we want to know about your values and beliefs, and how they shape your approach to healthcare policy and leadership, especially in time of crisis.
So my values are basically servitude. So what I do spiritually is I ask the Creator, whatever way you describe Creator to be, to use me as a vessel, you know, and in so doing, you volunteer, you know, spiritually, and you say, okay, I'm available. If you want to use me, and create the connections and create the opportunities. I'm here to work for you, know, and so those are the values that I've always lived by, you know. And so even when I was in academia, what was my value base? My value base was to find solutions to indigenous medical problems, you know. So in my discipline, I would be observant of problems and try and find an evidence-based solution to a local problem in my discipline or in my environment. So, for example, I grew up in the era of HIV on the continent of Africa and in the Caribbean, and that became my focus, to find solutions to how to manage HIV, both the disease itself and the consequences of HIV, which for me were, in hematology, were bone marrow failure and the malignancies associated with lymphoma. And so I became an expert in the hematology and medicine of HIV and complications of HIV. So I was looking at the prevailing problem and becoming an expert in finding the solutions to that, which led me further on to looking at other viruses that have moved from the ecosystem into, and that's how I became interested in the biosecurity aspect of humanity. So my value base is always to serve. So I find being in a position of a commissioner that you are the number one health provider, and you are responsible for the health of 30 million people, and by extension you influence what's going on around you in the rest of Nigeria and the rest of Africa, and your purpose is to serve your community, you know. So being Health One Lagos means I'm at everybody's mercy, you know. So anybody can call me, both a man on the street or a head of an institution or anybody. I mean, walking down the street and people ask me for help if they know who I am, you know. So my job is to serve, you know, and I do that as best I can, but primarily to serve in policy formulation, because it's through policy that you can have the greatest impact. So being in a clinic and treating patients is great, but being in a position to establish policy that influences millions of people, is even greater. So I found that, in the 20, 30, 40 years that I've practiced as a medical practitioner, the last 6 years have had greater impact than my entire academic year put together, because, in a position of policy, you're able to really have far-reaching impact. When you're not in policy, you're constantly trying to lobby policymakers. So when you get into a policy position, then you are the policymaker. So you can pull from your resources, but you also know where to go to find people who have the information that you want, to perfect your policy. So being an academic before you become a policymaker is actually a very nice combination, and to be honest, I wish I'd made this transition earlier, because now I'm 60 years old, I'm getting a bit tired. If I'd done the transition maybe 20 years ago, I would have been maybe a more energetic and a more aggressive technocratic politician. So now I'm a bit soft. So, yeah.
Thank you, sir. You've spoken about policy, its formation, and its impact. So now I want to know about the most common challenges facing public health in Nigeria today, and in Lagos especially, and how they can be addressed.
So one of the biggest challenges is human resources for health and health financing. And they sort of dovetail into each other. So the human finances or health financing for health is weak. And when you have health financing, the health sector becomes unattractive, to the people in it. First of all, you don't want to go in it because it's not lucrative enough. Your counterparts who study law and architecture and engineering, first of all, their course time frame is shorter than yours. They get launched into their career earlier than you. You're still running around doing on-call while they're sitting in nice air-conditioned offices and giving out very large denominated invoices, so it's a different career path altogether. So the issue around health financing in Nigeria and in Africa is that we're not putting enough emphasis on the quantum of health finances that governments need to put into the system. We're trying our best to meet the Abuja Declaration, but in the continent of Africa, we have a low tax to GDP ratio. So first of all, it's not like you're living in Europe where everybody is paying tax. Here we're essentially a tax-free continent. People, unless you are compelled to pay tax by virtue of where you work, and the workforce is not, most people are not in the formal private sector, they're in the informal private sector. And in the informal private sector, it's difficult to hold people and extract your taxes. So governments are on the weak side in terms of income generation and budgetary size. So when you have low budgetary size and you have all these competing interests, you have education, you have transportation, you have agriculture, you have environment, you have security, then the pie has to be shared out, So the health sector gets what it can, which is not enough, because my realistic budget is much higher than my actual budget. So if you ask me, what do you want as your budget, Commissioner? I will tell you, this is what I want to do, A, B, C, D, E, F. How much does that cost? You find out it comes out at almost 5 or 10 times the cost of what I actually get. So I need to now be creative in finding the gap, right? Whereas in the more developed environment, you will find that people, the allocation to health is much higher. The allocation to research in health is much higher. So because of that, you now find that the health environment is not that buoyant. Generally speaking, we think of health as a social aspect of life, rather than a contributor to the economic growth. Okay, so if health is now operating on the fringes of the economy, because it's seen as a social safety net rather than a contributor to the mainstream economy, then the reward that you get for your services is generally on the lower side compared to your counterparts in other disciplines. So that will encourage your colleagues to emigrate in what we see as the great movement of medical professionals out of the country, the brain gain phenomenon. And so you have to look at the root cause. It's not that people want to go, it's because people see that their counterparts are living a higher standard of living than them. They're exposed to more opportunities, they're exposed to more training, they're exposed to a softer environment. And so people get attracted out of the country. But if we fix that locally and domestically, then our human resources will remain slightly buoyant. We're not making enough professionals, that's for sure. And the ones we make are attracted by this phenomenon. So we need to do two things. We need to bring health back into a situation where it's actually part of the mainstream economy that will attract investment into the sector. It will attract people wanting to be doctors not because they are humanitarians, but because it's a lifestyle and a remunerated profession that keeps you comfortable. There will be less of a pull from other climes, because you're getting a satisfactory remuneration package for your services compared to your counterparts abroad, because I think you all do the maths and you say, well, what is my friend earning in London and New York? We studied together, he left and I'm still here. He's getting £5,000 a month and I'm getting X amount of naira, and you do the exchange, you apply the maths and you think, wow, I'm really underpaid, But it's not as simple as that. But to the mind, that's what creates the urge for you to want to japa out of the country. So if we fix it, not only will we slow down the urge to japa, but we will actually encourage those who have japa to come back. And at the same time, we need to make more professionals. As you know, this government is committed to driving a strategy of exponentially increasing the training capacity of Lagos State to produce thousands of medical professionals a year, rather than the 100 or 200 that we currently make.
Very interesting, sir. Surrounding all this, I want to know, what is your future? What's your vision for the future of healthcare in Lagos and Nigeria? What initiative are you most passionate about, sir?
So, this government is very, very, very keen on putting Lagos on the map of the continent, to make Lagos the place to come to for medical training and medical expertise and delivery. So we want to make Lagos the #1 place for medical tourism. At the same time, we also want to make sure that we've taken care of our citizens. So we want to achieve universal healthcare coverage, that is equitable access to good quality healthcare, irrespective of your social status. That's universal healthcare coverage. At the same time, because we are the commercial capital of West Africa, if not sub-Saharan Africa, we don't want to leave health out of that equation. So we want health to be part of the commercial narrative of Lagos State, which means that you come here knowing that in Lagos there is no specialty or subspecialty that you can't get. So if you're in Nigeria and you need some exotic procedure, instead of looking to Dubai or to India or to the UK, you say, well, but they do that in Lagos. Why do I have to travel abroad when it can be done in Lagos? People in Ghana, in Togo, in Benin, in Niger, Cameroon will come to Lagos. So we're trying to really position Lagos as the place where everybody gets high caliber healthcare delivery, irrespective of your status, but that we are positioning Lagos as the #1 place for medical tourism in sub-Saharan Africa, thereby using health as a major contributor to the GDP of the state.
That was very good answer. In 2022, former President Muhammadu Buhari honored you with the National Productivity Honor of Merit. How did you feel to have a unique contribution recognized at the national level? And what does this recognition mean to you?
Well, it was in recognition of the work that we did collectively as a health family in Lagos during COVID that was recognized by the president. So I just happened to be the head of the team, so I received that recognition on behalf of the sector. Yes, it was nice to be the deputy captain of the ship. The captain of the ship was the governor. I was the deputy incident commander. But of course, the narrative was in the health sector, and he was the chief navigator. And we worked very well together and were able to hold Lagos. And as government, your job is to protect the economy of your environment. That's what government does. It makes you're supposed to drive the economy of your environment. So whatever you do to drive that economy or to maintain the gains of successive governance is the responsibility of government. So my responsibility in government is to maintain the status quo of the economy, to not allow anything to undermine the trajectory of the Lagos State government's economy. So that's what we do in government. Yes, I'm the Commissioner for Health. So in my sector, I'm supposed to support the economy, make sure it doesn't have a downturn, and make sure that it continues to rise. When you think of it from the health perspective, it's the human capital index. So do you have healthy human beings who are educated and can now go and contribute to the economy of your environment and compete with the rest of the world? So I saw that award really as a recognition of a system that worked. And I was not the person that established the system. The system was there. I just took it as it was and used it to address a biological shock and prevent that shock from collapsing the economy and driving our citizens into poverty. And what we did in the end was the economy continued to grow even during COVID, and in fact we used the crisis, we turned the crisis around and we created a COVID economy. So we were able to keep our normal economy going and create a secondary economy out of a crisis. So we used, they say that if you get served lemons, make lemonade. So I guess we got served COVID. COVID was supposed to knock us down, but we used COVID to build ourselves up, And so I think that's the magic of government, that you can take a shock or a crisis and create something good out of it.
All right, sir. So you've held positions that many aspiring medical students dream of. What advice will you give them to help shape their careers?
So, one of the most important things is to stay focused. As young people, even in now I see that tendency is even stronger. You get exposed to all kinds of things, and it's kind of distracting, So you think you're in a medical career, but somebody's talking to you about business, somebody's talking to you about social media, you want to become an influencer, you want to do this, you want to go into that, you want to dabble in this. And so you lose focus, and the only way to become a high-value individual is to focus on a discipline and become to have your time and your expertise in demand. Okay. So what I would say to junior colleagues is, if you are in the field of medicine, you're there, you chose it. It's a hard discipline, but, focus on it. Find your niche. Find where it is in medicine that, or you don't have to practice medicine, for example, but you have a medical degree. You can use it in such a way that it's also as beneficial as practicing medicine. So focus is very important. Just identify where you want to go and stay on the course, and attain that level of expertise as soon as possible, because then your value goes up. People will want you for the expertise you have. The more expertise you have under your belt, the more value you are to the community. So the sooner you acquire those skill sets that make you feel good, you have to be enjoying what you're doing. So when you wake up in the morning, you wake up enthusiastic. You don't wake up and say, "Oh Lord, it's another day in the office." But you wake up in the morning and go say, "Yes, what I couldn't finish yesterday, I'm going to tackle it today." So you must be enthusiastic when you wake up, not another boring day. In the General Hospital or in the LASUTH or in the Ministry of Health. You must wake up in the morning and say, "Wow, I didn't finish this yesterday. I'm going to try and tackle it today," and keep thinking about what are the things you need to do. So focus. I was influenced in my life by great people in different disciplines, and the one question I always asked people was, how did you become a great architect? How did you become a great pilot? How did you become a great engineer or a great lawyer? And there's only one answer that I always got, and it was, I remained focused. So that you're not distracting and becoming a jack of all trades. You remain focused on what you want to do. And if you don't like what you're doing, then change. But whatever you change to, stay focused on that. If you want to be jumping all over the place, then you will just be, as they say, a jack of all trades and a master of none.
Okay, sir. In such a demanding career, how do you find balance and make time for family and personal interests? And what are the things you do at your leisure time, sir?
Well, unfortunately, there is no leisure time in politics. So I can't answer that question right now. And when you go into a position like this, you give your life and your soul to the people. There is no time. There's no time for yourself. There's no time for your family. It's a huge sacrifice. The problem you have is your family have to accept it. You know, that they've given you over to the people for a period of time. Of course, you have to try. You know, at least you have to try and get some rest. You have to communicate with people. But generally, your family and your friends recognize that they have lost you for that period of time. And even your children or your immediate family compete with governance. But that's the choice you make. You know, it's like going into the army. You know, they would send you to a barracks, and from barracks to war. You know, you can't say, I don't want to go to war. You know, you join the army. If you join politics and governance, you can't say, oh, I want spare time. There is no spare time. Lagos is constantly in a state of crisis, whether it's, you know, every day I wake up, there's a new problem in the health sector, you know, and I work from morning to night. So there's no Saturday, there's no Sunday. Every day is a work day, you know. It's Monday to Monday, you know. So unfortunately, if you value your private time and you value your hobbies and you value your friends, then maybe being in governance is not so much for you. But then you don't have to be in governance forever. You can come in and do it, but while you're doing it, just know that your ability to have spare time is just not there.
Thank you so much, sir. So the last question is, do you have any parting words or final reflection for our readers, sir?
Yeah, I think, you know, one of the biggest issues that we have on the continent of Africa is a lack of trust in governance, you know, and I must say that, you know, there are legitimate reasons for that, because people feel that politicians and government policymakers have betrayed the trust of their constituencies. But I think that we're moving into a new dawn, a new era. I have certainly seen the commitment of the successive governors of this state. And truly, I find that, you know, the heart of the people, they have the heart of the people, you know, and their real intention is to make an impact. So I feel that the trust deficit that we talk about across the continent is actually there, but in Lagos, that trust deficit is not as wide as it is in other parts of the continent. So it's very exciting for me to be in a government where, you know, your principle and your previous principles have set a standard of serve the people, you know, and diminish that trust deficit. And I believe that this government, you know, I sit in cabinet every week. I can see that, you know, the real purpose of why we are in cabinet is to serve Lagosians. And I think under the leadership of His Excellency Babajide Sanwo-Olu is really a heart for the people, you know, and it's a pleasure to work inside a cabinet like that. This is my second cabinet, you know. It's the two dispensations are just as committed to serving Lagosians, and we do it tirelessly, you know, and constantly looking for how we can make Lagos that model of governance across sub-Saharan Africa. So those are my parting words. Lagosians, trust in this government, you know, it really means well, and it has your best interests at heart.
Thank you so much, sir. I think that brings us to the end of the interview, sir. Thank you so much, sir.